I've been asked to talk about how do you treat at different ages skin, most importantly starting in your teens, because as we all know, the younger you start, the more you slow down the clock. Now we all know that you are what you eat, food is your medicine, that really matters, particularly if you have acne, but also rosacea, enlarged pores, brown spots, all that is what you eat really matters. And I'm not about deprivation, but you can eat healthily and tastily. You just have to be educated. It's about knowledge is power. So part of why I do these videos is try to educate you so you can educate yourself so you can make better choices. Because those choices impact you for the rest of your life. It's just like, look, everybody loves to get a suntan, but at the end of the day, later in life, when you have brown spots everywhere and you've got wrinkles, etc., that's the sequelae of your choices. And you can mitigate and moderate those choices, but again, knowledge is power. And we all think that, oh, it's not going to happen to us, it'll all be good. But look at your parents, number one, to see how you're going to age and what your challenges are going to be. Whether it be bags under your eyes, loose eyelids, loose necks, brown spots. Did your parents have acne? Because we also have genes that we struggle with. And again, as you well know, you activate those genes with internal inflammation, and that inflammation is about what you eat, exercising, releasing stress, trying to be happy, trying to be less stressed. So when you're young, look, you don't like to do so much if you're trying to eat healthfully. One of the things that I see with young people is there's a lot of vegan vegetarians, and there's certain blood types that are just more keto blood types. That doesn't mean you have to eat animal protein, okay? But O-type blood, and even the vegan vegetarians will tell you they're very poor vegan vegetarians. And so you have to get enough protein for your skin, for your brain. The more active you are, the more you're studying, the more challenge you are, you have to have enough protein for your brain to work on. And that protein could be lean protein, it could be pea protein, it can be a macrobiotic sort of protein, and lots of green, okay? So what you eat, exercise, and then internally, 18 to 25, 28, 29, you really, look, everybody, from the time they're born, people need to take vitamin D, because vitamin D is anti-cancer, and yes, there are cancers at all ages and increasingly so in today's world, and I don't want to scare you, but everybody needs vitamin D. It's for your bones, keeping your bones good. Exercise keeps your bones good. And you want your bones to be built and strong when you're younger, because you start to lose them when you're older. And it helps keep your joints better. It helps decrease the risk of having joint and hip and all sorts of things later in life. Exercise, all those things help keep you lean, increase your metabolic rate forever. But so vitamin D, critical. Everybody needs to take vitamin D. Young people, meaning early teens to 28, 29, depending on how active you are. It could be, and you do need to have a blood level done, ideally once a year, but at least every so often. But I give people 5,000 IUs a day, because the American Academy of Pediatrics recommends 2,000 for babies, but 5,000 a day. Young people, 5 days a week, okay? Once you get 28, 29, you need to do it 7 days a week. And then the more active you are, look, if you're pregnant, they're doing your blood work. You want to keep your vitamin D blood level high normal. The other thing is everybody should be taking glutathione, not only because it's antiviral, good for your teeth, good for your skin, anti-aging, anti-inflammatory, and one of the strongest anti-inflammatories. Combine that with a healthy diet of a lot of green, garlic, onions, those things, just that. And then if you can throw in some vitamin C internally, ideally 1,000 milligrams at least twice a day. I preferably like for people to do even my Camu Camu, which is the natural form, 100% natural form. It's yummy. It's also got some other antioxidants in there as well, which is 3,000 a teaspoon. Put it in water. You can take it to the gym. You can take it when you're walking. You can take it when you walk around with a water bottle all day. You can take it once a day, morning or evening, whatever, vitamin C. But at least vitamin D and glutathione internally. And then as you get older, you do more antioxidants. Now, when you're young, as my second brain here, thank God for her, reminds me, is probiotics. Everybody needs probiotics. Number one is, look, food's not sterile. Okay, why do we get food poisoning? Food's not sterile. And so probiotics help populate your gut with healthy bacteria. There's so much written about a healthy microbiome nowadays as far as mood, as far as thinking. But it helps prevent against parasites, against bacteria, against fungus, against all sorts of things that we eat. And the other part and parcel of that is if you get gas bloating when you eat, you may need optimized hydrochloric acid. What's the alternative to that? Is raw apple cider vinegar, a teaspoon and 4 ounces of water with a meal, but it's usually not strong enough. And also you need to have a bowel movement every day without thinking about it, ideally twice. And if not, your gut's not healthy, and you really need to look into that. But probiotics is step one in that. And, well, step two after what you eat and exercising. But probiotics, all probiotics are not created equal. The probiotics that we use, which have Saccharomyces in there, which makes the gut a better place for implantation of healthy bacteria, which helps prevent the bad bacteria. So probiotics matter. There are a lot of different probiotics on the market. Some of them are not so strong. And so I'm all about maximal strength because maximal strength is maximal protection, basically. And if you're A-type blood, aloe juice, okay? Take 2 ounces or an ounce at least of aloe juice so you're going to the bathroom every day without thinking about it. It's very synergistic with the probiotics. The other thing is we're going to your skin. So 18 to 28 or so, really you can get away with just doing a couple of things. Number one is serum. Serum, well, number one is really cleanser. Cleanser matters. If with all the pollution and all the air and sweat and makeup and everything that gets on your skin nowadays, you've got to have something that cleans out the pores. So cleanser matters. You've got to have a cleanser that goes in and cleans out the pores. If not, your skin doesn't breathe and detoxify itself as well at night. Things don't get in as well. And so it's very important to use a good cleanser. And so my cleanser, absolutely, you'll see it. It's one of those products that once people use it, they never stop using it. So that tells us, number one, how good it is. And also, when you wash your face is indeed clean because it's gone in and cleaned out the pores. if you have acne, if you have blackheads, and when you're younger, you get blackheads because if you're stressed, your DHEA, your adrenals, your testosterone can be higher. You can put it on your back. You can put it on your chest if you have it. Helps that. If you have chest or back acne, it's because your gut's inflamed generally, but it helps get the sebum that is oxidized and from extra oil that's produced when you're stressed. It helps get it out of there. Very important. Then comes my serum because it's incredibly anti-inflammatory and it's feeding the skin everything that it needs: vitamins, minerals, antioxidants. It's anti-inflaming it. It's calming it. It's nurturing it. It's, again, as if the food truck came up with the healthiest food and just shoveled it into your mouth, but you're putting it on the surface of the skin. Ideally, you do it at least once a day, okay? It's generally moisturizing enough at that age from 18 to 25. If not, what do you put on top of it? You put my wrinkle filler, which is a little touch. You put a fingertip size amount of a little hyaluronic on top. That's enough moisturizer. You've got to exfoliate your skin. If you don't exfoliate your skin, then the amount of collagen production decreases, and so you're not stimulating anti-aging. You're not stimulating getting rid of abnormal cells and abnormal pigment and growths that are trying to grow. And so my exfoliating repair, I have people use that at night. They wash their face with my cleanser. They put, while their skin is still wet and warm, so their pores are open, they massage it around for a minute, especially on the nose, the cheeks area, wherever you might have pimples on your neck, your chest, your back. You let it dry. You sleep in it, okay? You can do that. You have to see, depending on how oily, how thick, how dry, how thin your skin is, you may need it once a week. You may need it 3 times a week. You may need it every night if you've got oily, thick, acneic skin. Incredibly anti-inflammatory as well. So the next day, if you've got pimples, you see your skin gets better. Now, if you've got more challenging skin, if internally you're not right, if you're eating things that are bad oils, foods that are not healthy for you, if you're really stressed, you may need more. One of the things that I made at night, because the skin does certain things in the day, it does certain things at night, is night regeneration. Night regeneration is very anti-acne. It has no oil, but it's moisturizing. So if you need more moisture than just serum and maybe wrinkle filler if you need it, because you can use serum twice a day, then you use night regeneration. Some people who have more challenging acne who come to see me because they've got a bigger problem, then I'll add vitamin A+. But generally you can get away with cleanser, serum, exfoliating repair, maybe night regeneration, or maybe it's just serum twice a day. And how much serum? 2 to 3 drops. You put it in your palm, you put your finger under the tap, you put in a drop or 2 of water, you put it all over your face, put everything always on your eyelids, because otherwise, as you go down the path of life, your eyes will look older than where you didn't put the skin products, which shows you that the skin products are working. Then as you get older, what do you add next? Vitamin C+. You mix that in the morning with serum, maybe wrinkle filler, and that's stimulating new collagen production. It's helping to prevent fine lines. It's forcing new collagen production. So once you get 28 or above, now, if you're having children earlier, you need to do things earlier. That's when you need to use vitamin C earlier. So if you're having children at 21, 22, 23, you need to add vitamin C earlier. Once you hit 30, you need to add vitamin A+ at night. because it penetrates more deeply. None of these products are redundant. They're synergistic. They're all doing something different. And vitamin A plus penetrates more deeply. The more you have to treat the skin in 3D as deeply as you can. So then you add vitamin A plus. If you've got significant acne, you add vitamin A plus at night mixed with night regeneration. But that's if you're younger, but certainly once you get to be 30, you're adding night regeneration, you're adding vitamin A plus at night, you're using vitamin C plus in the daytime, you're still using exfoliating repair, and then once you get to be 32, 33, 34, 35, you go from exfoliating repair to peel. Peel is stronger. Oftentimes with acne, I have to bring in peel at a younger age because it peels more significantly, makes it really hard to make a pimple. But certainly as you go down the path of life, it's lifting, it's tightening. So once you get to be 32, 33, and again, depending on how your life is, how stressful, watch how quickly your parents are aging. But the earlier you start things, the more slowly the clock ticks. But I don't want you to use more than you need to use earlier than you need to use, which is why on the website there's all the skin pathology solutions and why we do consultations, virtual consultations, because some people need more earlier. But overall, this is how you do it. Now, on the website, there's also how to start an advanced skin products. But once you get to be 36, 37, 38, you need to be using as much as possible. You need to be using serum. You need to be using the cleansers, of course. You've already been using that for a long time theoretically. If your skin is drier, you need to bring in Emu Dermal because the neodermal in it is stimulating collagen. Emu is much more moisturizing. Some people don't need that much moisturizer. They can just get away with serum and wrinkle filler. Once you get to be 40 plus, you add in Cell Optimizer because it has ingredients in it that are forcing your skin to lift and tighten, giving it a memory, as if it's gluing it up there, but it's with ingredients that penetrate and forcing new collagen production. And so ultimately, are you using all the products? Yes. Are there other products that you need? No. I have dealt with all the ingredients on the market. It's about the strength. It's about how many ingredients are in there, the strength of them, the purity of them, how they're formulated. And if you start early, you will be slowing down the clock. If you then bring in ultimately after vitamin D and glutathione and then vitamin C and you add more, then comes omegas. You may need adrenals because you're all stressed out. Again, all this is on the website, but between 18 and 26, 27, 28, let's say 30, really cleanser, really matters cleanser, serum, wrinkle filler, and exfoliating repair, you are in a major way because of the ingredients, the strength, and the formulation, and you will see it, and you will see that, and your friends will see that your skin has a clarity. You won't see the fine lines. I have a lot of people who come to me at really young ages and they're like, I need Botox, I need this and that. The problem is that what they need is to be using the right skin products. They need to spend their money on every day what's slowing down the clock, preventing, reversing, and generally they don't need that. Now, genetics is always at play. Getting sleep is essential. Your skin and your body repair the most between they say 10 o'clock, but let's say midnight and 5, 6 a.m. You need to get, absolutely, you try to get at least 6 to 7 hours of sleep a night, because for repairing your skin, for brain repair, they've shown that it's anti-Alzheimer's as well. It really makes a difference. So, you are what you eat, food is your medicine. Antioxidants to a certain extent, exercise critical, and then skin products that work, that are strong enough to do something. Because look, there's organic, but organic doesn't mean it's therapeutic. And therapeutic means that you see a result. You do look better. It is clearing up what matters. So, hope that helps. There's a lot of information on the website. Start there. Thank you.